health care insurance under the ACA, how does the decision not to expand Medicaid impact them? Okay, I'm not sure I can answer that. They're really two distinct things as I understand it. And first of all, let me say again, this is probably all going to change in the next 100 days with the new Congress. But the healthcare exchanges were set up so that an individual who did not qualify for Medicaid under the new terms, which increased the amount of money you could earn to still qualify for Medicaid. So it's a level above that. You could go to the healthcare exchange and get a subsidized health policy, and the rate was supposed to be better than what you were able to get in the private market prior to that. I don't think it turned out that way. But the decision not to expand Medicaid, I do not think impacted that directly. The decision not to expand Medicaid in Mississippi meant that our Medicaid program had less dollars and the same number of people to deal with, but we also had this entire population, which we call the working poor, which didn't have a payment mechanism. So the idea is that if you don't have routine health care, then you wait until the problem becomes so dire that you are about to die and you show up on an emergency room doorstep, where the cost of medical care is sometimes quadruple what it would be if you got maintenance care all along. So that's the real problem. So the cost to our Medicare program are higher than they would be. The insurance issue under the ACA is something that I really am not equipped to address. I don't know why. For instance, we only had one insurer in Mississippi for a time that was writing coverage. I think the insurance commissioner was able to get two, then one dropped out. The premiums never did moderate the way folks thought they were, and that was one of the major complaints of, against Obamacare. So I'm not sure if I answered your question, but that's what I know about that issue. Yes, sir.
One quick question. Approximately what percentage of the state budget is for Medicaid?
That's a very good question. It is not as large as you would think. The largest part of the state budget is public education. And the next largest part is probably transportation and infrastructure, but I'm guessing that Department of Health and Medicaid comes in third. I don't know what percentage it is, so I'll try to find that. And I should say at this point, anybody who has a question that I can't answer, if you will give me your name and number after we're done, I will make an effort to try to get you an answer to your question. I don't know it all as I stand here.
Florida, I understand, spends roughly 30% on Medicaid, and they have less poor people, I would assume, than Mississippi has. That's why I was just curious about how Mississippi treats their poor people versus how other states treat their poor people. Because we have a very large population.
As a percentage, we do. I think we probably have the largest percentage poor as defined by being under a certain income level.
And we continue to have this large percentage of poor people. We have a Republican government here, and we've had for the last 20 years, and they're supposed to be good administrators, but yet we continue not to make any progress.
Well, I don't want to become partisan up here, and you're right. There are problems that haven't been solved under either Republicans or Democrats, and what I want to talk about is how we can solve those. And I do think that our approach that we're taking right now at the Capitol is wrong. I don't agree with it. I don't think we can cut our way into prosperity. I think the trickle-down theory has been disproven, and unless we change history in Mississippi over the next few years, I'll continue to think that. I firmly believe that we have to provide a basic level of health care for folks so that they can get in the workplace. And I think we have to help them stay in the workplace. And one of the things that we're not doing in Mississippi to help working men and women stay in the workplace is we're not spending a considerable amount of money that we get through, I think it may be the SNAP program, that could be used for child care to help people who want to work, but they have to weigh, do I pay to put my children somewhere and have my children kept and pay so much that it doesn't justify the job that I get? And when they make that decision, it's an economic decision to them, and a lot of people make the decision just to stay home with their children. But if they had a way to have some assistance with child care, then they could get back in the workplace, they could become a productive citizen, and they can grow. They can be paid more the next year and the following year, perhaps get some education and training. so that one day they can afford their own child care and they don't have to have that subsidy. So those are the kinds of things that we could do that I think would improve the situation in Mississippi that we're just not doing. So thank you for those questions. Let me go back to infrastructure for just a minute, and then we can talk about education or anything else that you folks want to talk about. As I mentioned earlier, we have a lot of bridges and roads that are considered substandard. There is a list that engineers with the Mississippi Department of Transportation have created there's a list of bridges that are so bad that they're posted, they call it, and there's another list of bridges that just need to be repaired. They're both very long lists. In a lot of communities in our state, the buses that take our children to and from school have to reroute to go around those posted bridges because we don't want to have a bus go over a bridge and have the bridge collapse.